All right, and we are back. Good morning, Kenya continues. My name is Vivian Ndegwa. Now let's head straight into health matters. There's a high probability that each one of us will experience some sort of injury in our lifetime. And for that reason, today we will be looking into wound care. How do we take care of any kind of wound that you may be having at the moment, or you may know someone who is experiencing or has a wound. Joining me for this discussion is none other than Dr. Kennedy Omondi, who is an advanced wound care specialist.
Thank you so much.
Welcome to the program.
Most welcome.
How are you feeling this morning?
Feeling great.
I would really love to know why you decided to specialize into, wound care specifically.
Into wound care. Interesting. I lost someone close due to negligence in a facility. She developed complications as a result of wounds. She developed sepsis, which wasn't taken care of. By that time, I was still a student, and I couldn't do anything because I didn't have the basic information on how to do this. I wish I had. But due to this one, I really developed a lot of interest in wound care, and I said, this is not going to happen to anyone under my watch. So I really took the initiative and got the knowledge, which I don't keep to myself. I really disperse the knowledge as well, so that most of the people, most of the colleagues in the healthcare fraternity can have at least basic knowledge on how to do advanced wound management. Yes.
All right, and I'm sorry about your loss.
No, it's okay.
And we're glad that you're willing to share this information. And I mean, you're here, so you're here to also share more on wound care. If we may just define what a wound is.
By definition, a wound is a physiological injury which compromises the normal integrity of the skin. To mean anything, regardless of how small it is, as long as that normal integrity is compromised, we call it a wound. So there will be different types, and the immediate category is an acute wound and a chronic wound. An acute wound, ones which is progressive positively to heal, like there are those we normally call phases of wound healing that are continuously occurring, whereas a chronic wound, there is some degree of stasis. This wound stagnates at a particular phase, to mean it's going to have several interventions taken for it to proceed on to heal. So it will take a little bit of more time.
Okay. Yes. Is that the same way we get to clarify, or to classify rather, wounds according to their severity, acute and chronic, or is there a way to classify wounds in terms of severity?
In terms of severity, okay, that will be a clear-cut distinction on severity, because what you normally look for is what is making it severe. Either there is sepsis, or there is an infection, there are dead tissues or non-viable tissue, there is a lot of exudate or moisture which comes from this wound, the type of edges, underlying condition. So there's a lot of things that normally brings about this severity. So when you just split it into two, like an acute wound and a chronic wound, it clear cuts the categories.
Okay.
Yes.
I believe that most things can be, I don't want to say healed, or rather can be helped or worked out via lifestyle, the lifestyle that we choose to live. Is this true with wounds? Like, is there a certain lifestyle that you may, undergo or take each and every day for you to help your wound heal quickly?
I can say yes, particularly when talking about diet. That become one key thing when it comes to wound healing. Remember, particularly proteins. Proteins are the building blocks to help with the regeneration and renewal of these tissues. So those subjected themselves to protein intake find themselves, actually we put patients with wounds on high protein diet so that they can be able to heal quick. Fluids intake like water, those are just pluses. The minimum requirement, at least high protein diets, normally very key when it comes to wound healing.
Yes. What are some of the most common wounds you get to deal with?
Currently on the increase, we're having a lot of patients with diabetic foot ulcers. These are complications arising to severity of diabetes. We're having also very common venous ulcers. It's a vascular condition. It comes as a result of poor venous flow. We're having, on a little instance, arterial ulcers, not so common. Then trauma, very majority of patients actually who are seen in our facilities because of trauma-related wounds. That is due to accidents, due to cuts from homes and such, violence. Then other conditions due to underlying conditions like now HIV, skin conditions that can escalate to severe wounds. Those are other things that can happen here. Burns, also very common, but not quite in comparison to the other types of wounds.
Okay, we are going to get into each of those wounds and how to care for them, but you mentioned a diabetic wound, and there's a feature I saw a while back where they were using live maggots to heal, you know, a diabetic wound. How do we go about that? Like, just give me an overview of how that happens.
This is interesting. Okay, we call it maggot debridement therapy. And these maggots, you know, this is a life cycle of a housefly, but it's a particular housefly that's normally used, which only feeds on dead tissues. It's unlike using any other type of a fly. Not all flies will give yield to the maggot that we use for debridement. So this is normally particular because it will feed on the dead tissues. It stimulates even infection management. Normally we talk about biofilm eradication and stimulate growth. So not only is it going to feed on the dead tissues, so we found that one of the complication of diabetic foot, maybe some patients end up with necrosis or gangrene, or just some extent dead tissues on the wound. Some patients, we may not be able to take them to theater. Because of several reasons. So by introducing these maggots, you'll be doing what you could have done in theater, but using a biological way. So these maggots just feed on the dead tissues. They don't go into the other tissue which is not dead. They just feed on the non-viable tissue only. After that, they're normally removed. They can be replaced according to need until the wound is completely clean. Then an intervention can be done afterwards.
Okay, so they get in there and they just eat the dead tissues only.
Yes.
That's how you use to treat. That's how you use maggots to treat the diabetic wound. That's interesting.
It's also not diabetic foot, diabetic wounds only, even other wounds, as long as there's dead tissue. And there's somebody normally say it's an indication. It's an indication to be used. Remember, not all wounds you can be able to introduce the maggots. Just specific wounds, but under guidance. Not all wounds will be. Yes. Okay,
because we might have people who are watching and thinking, you know, I can just use maggots, you know, and they
are sterile maggots. Actually, they're sterile. They're put in a sterile way, not just openly catch some flies, maybe the legs on the wounds. But this is a way they're normally like cultured.
Yeah, so it needs to be under the watch of a doctor to do that. Okay, there's also another remedy that I saw, which is using of sugar in treating ulcers, and that was specifically leg ulcers. They were using sugar to treat that.
Those ones are, we call them the orthodox method. These are therapies that now have been passed with time, with advancement. Because you see, the whole idea that was used then was to try and divert the attention. Remember bacteria and bacteria primarily, they feed on sugar. So by providing an extra source externally, it means you'll be diverting the attention from the wound into now the physical sugar which has been added. But you see, it has also repercussions whereby when you provide food, they multiply in numbers. And this multiplication of numbers means you're going to increase the bacteria burden once they deplete the sugar that you put. So to mean the number, let's say, has tripled because the food was provided. Now that goes back on the wound. So to curb all this, there are these therapies that have come up, scientifically engineered materials that could be able to kill the bacteria or just inactivate them, or just make them inactivate them so that they cannot be able to affect the wound. So we use these modern therapies in comparison to other modalities. There's even the use of honey. People used to do honey on wounds. Currently, there are honey-based wound dressings. Has got the same structure, actually the natural honey, but now in a scientifically engineered product whereby it will do the same thing, but without it inactivates this bacteria, so the bacteria does not go back on the wound. So inactivate it inside the dressing material. So when you remove the material, you remove it plus the bacteria. Yes.
You've mentioned that those were ways that those were techniques that were used back then. You know, what are some of the advancements that being used now in treating wounds?
In treating wounds. In addition to now the maggot debridement therapy and these scientifically engineered dressings, the foam dressings, we have gels which can be used. We have several post-operative dressing. We have modalities like the negative pressure wound therapy, commonly known as the VAC, or the vacuum assisted closure. These are techniques whereby it's a device connected in order to achieve some specific results. You want to drain a wound, you want to have it closed, you want to protect or prevent surgical site infections, you can be able to use such. Then we also have like growth factor concentrate injections. These are injections which are you just get whole blood, you derive the growth factors from it, or maybe you derive the platelet-rich plasma from it, and then they're injected inside. Those ones help as well to regenerate tissues faster. Yes.
Okay, I would love for us to now get into the different kind of wounds and how to treat them, especially wounds that I feel like are really common, you know, even just for that happen normally on our day-to-day. For example, we may start with maybe a sting. Just a sting from the from a bee or some insect. How does one go about that?
Those are common. Okay, remember by definition we said if the integrity of skin is compromised, that one falls under the category of a wound. If it's not, you find that that one escalates into a different group. So a sting, you wouldn't say as per se falls under the category of wounds, but can still be, it can complicate into a wound if not taken care of appropriately. For instance, you'll find there is inflammation, there's normally swelling and pain, that redness. You can be able to identify the source of entry at times. So for stings, simply normally try to remove first the sting itself. Let's say you've been stung by a bee, you need to remove that sting. We normally say don't try to pull it with maybe your fingers or something, because there's that risk of maybe even pushing it further. You normally try by sliding. If you have something like tape, you slide it across. It will stick on the tape and most likely come out. I know there are several tapes, find that from home, or you can be able to find something which is adhesive. Then try to cool it. If you have something cold, for instance, like ice or maybe just cold water, this normally helps to prevent the swelling or the inflammation. In an advanced setups, normally these antihistamines are normally given, or maybe some a steroid cream can be applied. They just help to prevent the inflammation. Most of the time, these are self-limiting. And self-limiting means they can be able to recover even without advanced intervention. But those that are normally life-threatening, advanced intervention may be needed. Those who end up in what we call an anaphylactic shock, or the nervous system now becomes or this overreaction. The body systems can start shutting down. Now, for such, normally requires immediate medical care.
Okay. Yes. What of a burn? You were cooking, you're in the kitchen, you were cooking, and then maybe oil, you know, got onto your skin or something of the sort. I'm being told we take a short break first, and then when we come back, we'll get into the different kind of wounds that we may experience or we may get to get while in our day-to-day lives. Okay, welcome back. In case you're just joining us, I am joined in studio by Dr. Kennedy Omondi, who is an advanced wound specialist, and he is here to just let us in on how to take care of different kinds of wounds. And before we went for that break, you were just about to get into how to care for a burn.
Yes. Before talking more about burns, burns can arise because of different factors, not just anything hot. Remember, there's also electrical burns, you have exposure to radiation, you have exposure to chemicals. Also, there's negative thermal effect, where you're subjected to extreme cold temperatures, you can have a negative thermal effect. So all are burns, and management is normally according to the cause. For those ones that are caused are caused by heat, let's say hot oil or hot water, maybe even exposure to direct flame, those ones are managed separately or differently. Remember, the first aid from home is normally to try and remove the causant. Like if it's heat, try and cool the area. You apply, let's say, just a clean cloth on it, and then pour cold water, or if you have ice, you can just be able to put it on top, not directly on the wound, but with something underneath. Do not poke blisters from home. I know most people normally have that, that once you've removed these blisters, then the wound will heal. Those are conditions that are normally done in a controlled environment, which most of the times requires a multidisciplinary team. But we can be able to say, if you suspect it's deep and if it's more than the palm size of your hand, then have it seen in a facility. That we normally call a category according to the size or the percentage. You've heard of 10% burns, 4%, as in those ones need to be assessed in a facility. Don't manage if it's circumferential, like if, let's say, the entire circumference of the arm is burned. For those small ones, I know that those are normally even recover without any intervention, but it's normally key if you notice any manifestation of infection, like there is redness, there is continuous pain, there is change of color in the surrounding area, or there's some different color of discharge that's coming from it, and have it seen in a facility quicker. But most of the burns, those small ones, maybe just an oil spillage, those ones, most of them are self-limiting. But precautions have to be taken so that they do not end up into worse scenario.
I've seen, or rather, I don't want to say it's me, or from the people I've interacted with, when you get a burn, you know, from oil probably, you're advised to like just pour some cold water on top of it and then let it cool, and then you apply petroleum jelly. Is petroleum jelly really something that would help with that?
Petroleum jelly normally comes in just to moisten, to prevent cracking and such severe. So just coming here to prevent cracking and breaking of the skin, so it just moistens. But ideally, when it comes to like there's a blister which is there, if it's popped, then please be seen in a facility, because that's an entry. See, the skin, when it's not compromised, it serves many purposes. Among one of them is preventing bacteria from getting into the inner environment. So once you have a blister which is broken, it means then you need to be seen in a facility. Even if it's not broken, be seen in a facility, you need to be put on some antibiotics for instance prophylaxis. In an environment which is sterile, the blister can be removed and a sterile dressing put on top. If that's not the case, then the blisters at times are normally left intact. If it's not, or if the depth is can be able to be estimated. For those deep wounds, I know the plastic surgeon normally come in handy. We normally talk about early excision and grafting. That's normally the ideal way to manage burns, because the tissue type, the cells, when a patient is burned, is not the same cells like when you're cut. There's a difference. This is inactivated, or this protein structure has been compromised, so regeneration is poor. But if you remove it, you'll be turning this wound from a burn into a cut, for instance, into an incision or a surgical wound. That one heals much quicker in comparison to the former status as a burn. Yes.
All right, what over deep cuts? You have been involved in an accident and you have this deep cut. How do you go about dressing or taking care of that wound?
For deep cuts, this one has to be in a facility whereby hemostasis, that is, you have to stop the bleeding. Some other measures have to take, for instance, debridement, removal of non-viable tissues, those tissues that were compromised during the injury, or tissues that you suspect are infected. Some of these ones might be removed. Surgical measures to close it is several. It can be stitched up. Some are normally too wide to stitch or to bring together. Those we normally call secondary closure technique. Will be done, like several interventions has to be done. Either dressing changes or maybe a graft or a flap can be done by the multidisciplinary team. So those are some of the quick ways. Dressings will be broad. Sometimes also there's this we call transcutaneous oxygen administration. Oxygen can be administered. So let's see if the oxygen is compromised, or maybe patients who've heard of these oxygen chambers, hyperbaric oxygen therapy, depending on the degree of compromise. Negative pressure wound therapy, I mentioned it earlier, to help close the surgical wound or to prevent surgical site infection. So the therapies normally involve, according to the phases of wound healing, to encourage minimize infection, manage moisture balance, and ensure that the wound remains closed.
What of a surgical wound? Case in point, a woman has given birth through C-section. How does one care for that wound?
This is normally critical, because remember, the deepest point is now, or the complication normally arising from this is normally pelvic, or the inflammatory disease, PID. I know this is more of a gynecological line, but when it comes to wound care, we normally also give advice when it comes to that. Ensuring the wound remains dry. Remember, at times underneath the belly, someplace maybe there is the garment, there is pressure on top, needs to be very dry, minimize moisture. Ensure the site is clean. So this is normally done by healthcare practitioner, because most of the times they're normally stitched up. And the kind of stitching and closure is normally for a prolonged period of time, so that you ensure there is no... I know people are normally curious, or maybe due to some practice, maybe, or something happened, patient factor, maybe the practitioner factor, some normally tend to open up. You find that some stitches which opened up, or maybe there's some sepsis, or God forbid, maybe something was left inside, there's some infection. So for such normally requires cleanup again in a facility. This patient has to be seen in a facility. Dressing changes, don't dress yourself. Keep it dry. If, let's say, the dressing is off, ensure moisture does not get into that, because most of the times they normally use the absorbable stitches. That does not really require to be removed. So if you allow it to be moist, those ones normally disintegrate fast. But for those with removable stitches, they're normally a little bit safer, but they can last longer. But also need to really ensure there is no moisture into that. Always covered until you're given a go-ahead to have it open.
It's interesting that you say that for that particular wound, it needs to stay dry.
Yes.
And I believe that a moist environment facilitates faster healing of wounds. If you can just get us through some of the right environments of healing.
A moist environment does not mean the wound is wet. There is what you normally call optimum moisture. This is a level whereby the internal environment is controlled, in that the moisture balance only facilitates for normalcy, cellular regeneration and growth. Because remember, when you talk about if we're having excess moisture, this is a state as we call maceration. The cells can be macerated. The cells are soaked into the tissues, into the fluid, either externally or from the internal wound, and that normally breaks down the wound further. On the other side, if the wound becomes extremely dry, the status we call desiccation, it can lead to cell death, because there is no normalcy when it comes to cellular activity. Cells die and can lead to dryness and necrosis. So optimum moisture, even by saying that ensure the wound remains dry, it means there is no that physical contact with water, because remember, maybe patient is taking a shower, water is running on top of the wound. It carries a lot of bacteria with it, especially if running on top of the skin. It's a lot of bacteria on the skin. So by that one is what I'm talking about, remaining wet. But optimum moisture on the other side, this is normally maintained by the dressing types. We have several dressing types that only ensures there is required amount of moisture, which is a requirement when it comes to cellular regeneration. So most dressing materials normally help to have this optimum moisture. Remember, there are also mechanisms to donate moisture. You find that some wounds are becoming dry, extremely dry. So there are also some dressings that are put to ensure or to donate moisture to this kind of a wound. When you're talking about the skin or incisions, you have an incision, let's say post-surgery, like even the CS incision. That's a different approach, because already the skin is intact. You've approximated the edges and brought them together. So the internal environment is one which is moist, but on the surface, you just require an environmental barrier to prevent the environment from getting in contact with the incision. That one becomes key.
All right. What are some of the signs of a wound infection?
That is interesting. You will say there are two types of infection when it comes to wound management. There is local infection, whereby the infection is just localized on the wound only, and systemic infection, when the wound is spread, the infection is spreading and also getting into the system. So for local infection, means it's the wound which is manifesting these signs. We have erythema, that is the redness, local redness, or the edges become a little bit red. There's normally foul smell at times. We're having a change in color for the fluid, which is, there's normally normal fluid coming from the wound, but it changes color because of infection and something. Then non-healing also is one of the manifestations that this wound is infected. Yes. All right. Some of the commonest. Yeah.
If you may please take me through some of the basic wound care techniques, the do's and don'ts of a wound.
First of all, remember we said, by definition, said the skin is compromised by it's a physical injury. That's what to define a wound. So anything that the skin functions have been lost by this wound. For instance, there is now possibility of an infection because there's a compromise, is open. So it means all wounds have to be covered. That's one of the do's. Cover all wounds, or don'ts, like don't leave the wounds open. Regardless of the size, okay, know that those which are self-limiting or can be managed from home, the others should be seen in a facility. Have a practitioner see your wound, because some normally escalate into life-threatening situation or into complications, which becomes later on very expensive to take care of or very difficult to manage. Then ensure your diet, or you're on a high protein diet. These are the building blocks for tissue regeneration and growth. So diet is also something that you need. Diet and hydration, very important, to ensure it's taken care of. And then if you're on prescription medication, then it is ideal to complete dosages and the prescribed treatment. Yeah, and then regular checks, as in regular dressing changes, depending on the severity. Remember, as well with these advanced dressing options for those patients at home, you don't need to have the dress changed frequently. There are materials that can even do 5 to 7 days without change, as long as you keep the dressings like dry.
All right. There's this question: is there a part of the body, or are there parts of the body that tend to heal much slower than others?
Yes. Not pointing into any part, but we normally say areas that are subjected to pressure, those ones will heal extremely slow. So we normally tend to offload the weight from such areas. Areas with a limited nervous supply, like if the nervous innervation to place is limited, this happens so much, especially in patients like diabetic patients and such, limited innervation. Areas with poor blood supply, there are areas with the thickened skin, like the sole of the feet and the palm of the hands. They normally tend to also take longer to heal. Yes.
Okay.
Yeah, that's common. Yeah.
What are some of the common wounds that maybe you've witnessed that most people tend to neglect, and it later, you know, becomes chronic or...
Chronic. I'll mention diabetes related ulcers or wounds. These are very common, and most of the times by the time these patients are coming to the facilities, they have really escalated, because you find the complications arises due to maybe unmonitored blood sugar. We have infection, we have dead tissues which needs to be removed in either a clinical setup, or these patients end up in theater. This is the most commonest neglected segments, because you find the others are normally easy to manage, like incisions and cuts. We have then also we're having these vascular related conditions. Most of the times people, because they begin just like a simple blister or maybe a pimple which you overlook, this will heal on its own, or this is too tiny. Within a very short time, then you're having the entire foot or the entire leg compromised.
Okay. Yeah. We normally say that a problem shared is half solved.
Half solved, yeah.
And there's also a statement that you also have in wound care that relates to that. It says that when the wound speaks, it heals.
It heals.
What does that mean?
Actually, we normally say the wound speaks to us. This is a statement that we try to even encourage other healthcare practitioners, that not always will you use one material for all types of wounds. So the wound tells you what it wants. For instance, this is the manifestations that the wound gives. The wound will give different manifestations. For instance, there will be non-viable tissue. When you're just doing your wound assessment, you see the tissues are not viable. The wound is telling you to remove the non-viable tissues. Put dressing materials that is going to help remove the non-viable tissues. When there is an infection, it's the wound which is speaking to you, like, please remove the infection. Use of antimicrobial dressing, use of techniques or systemic antibiotics to remove this non-viable tissue. When there is moisture, it tells you, like, wound will not heal, as in I will not heal until you manage the moisture. So that is how it speaks to us. So by doing an assessment, that is how you listen to the wound. There's appropriate assessment. You can be able to pick up communication from the wound. Okay.
Yes. As we get to finish on this discussion, if you may just take me through the phases of healing.
These phases, first of all, maybe what you need to understand is that not all wounds will follow this path. There is normally hemostatic phase. This is normally the first phase, but for only those wounds which are traumatic in nature, and there's compromise in the blood vessels, that there will be a bleeding. Maybe there's a cut, or maybe an accident whereby there is an object cutting through the blood vessels. So the first phase will be hemostatic, or the body attempting to stop the bleeding. After this one is done, or maybe progressively as this one is occurring, there is the inflammatory phase. In the inflammatory phase, the body fights back, or these inflammatory mediators, which helps to clean up the wound, to remove the non-viable tissues, to even the pathogens that have been introduced during the trauma, or the body is reacting, or this introduction, we normally call them growth factors. Those are some of the inflammatory mediators that normally are present in the wound at this time. They just want to prepare a wound bed which is ready for healing. Once this phase is done, the wound is normally clean. Like, there is no dead tissues, there is no infection, there is no like presence of bacteria in this kind of a wound. So it paves way for the next phase, which is the proliferative phase. In this phase, the body regenerates, so there is new tissue growth and the skin covers. After the proliferative phase have ended, then we find that now maturation phase clocks in. This is whereby the scar is now reduced into almost a normal skin texture and complexity.
Okay.
So with these phases, find that only traumatic traumatic-related wounds can follow those paths. Wounds originating from, let's say, vascular conditions, or maybe from even like burns, rarely will you get them like having the first phase, which is hemostatic, because there is no compromise on the bleeding vessel. So most of them start from the inflammatory phase. So as a healthcare practitioner, I also need to ensure that these phases run continuously and smoothly. Because if there is any stagnation at a point, that is what brings about what you talked about, chronic wounds. Chronic wounds, mostly the wound stagnates in the inflammatory phase, so it does not progress on to heal, it stagnates.
Okay.
Yes.
Very quickly, I believe that I should not wind up without asking this question. What should one have in their first aid kit at home in preparation to taking care of a wound?
For wound?
Yeah.
Antiseptic solutions to clean the wound. If possible, have normal saline. It's a solution which is very affordable. Remember, we don't put toxic solutions on the wound. They can further complicate the wound integrity. Have sterile bandages, have a sterile gloves so that you don't introduce infection to your wound. Have sterile blade, if you can get a sterile scissors. A bandage to wrap and apply pressure if you're having a bleeding. Painkillers are very important to have, like just the basic ones like paracetamols, because those ones don't really require a close check.
Okay.
Yeah, those are the basics that you can have in regards to wound management.
Okay, thank you so much, Doc, for coming to the show. Thank you for your time, and thank you for the information that you have just shared with us.
Much welcome.
This is where we put a cap right here on Good Morning Kenya. I believe that you have gotten to learn a thing or two from the entire show. I have been your host, Vivian Ndegwa. Until tomorrow, bye-bye.